What would you do if you had to go to a 911 call to someone that lived like this? Hoarders. They're very, very, very common in the 911 setting. Stay tuned in this video. I'll tell you what to do. So I've gotten called to this type of apartments, these type of rooms, one too many times. Rabbits, bugs, cats, dog feces, you name it, crack pipes, they're all in there. And the best way for you to attract or to go to this type of job is the very first thing you need to do is make sure that your everyday carry has a face mask and has goggles or whatever type of personal protective equipment you think you need to do this job right here. The way I would do this job, if I arrive and I find this, I put on a face mask right away. For some reason, I could see things, but I can't really smell them, because if I smell them, it kind of makes me nauseous. So the first thing I would do is put on a face mask. Then, if I haven't done so already, I will get at least 5 bed sheets, because you have to carry the person out of there and you don't want to put your skin or your uniform on the person. You got to find a way to get the sheet under them, cocoon them into the sheet, and carry them onto your stretcher or your stair chair that's probably in the hallway. So it's very easy to be disgusted in these type of calls, and it's most likely justified. But be disgusted by the rubbish. Don't be disgusted by the person, because this person may have psych issues or addiction issues, and they're a human being. So treat them with respect. Be a patient advocate. That's the very first thing I think about when I have these patients. They may have had esophageal varices from the alcoholism, and they're throwing up blood, and they might have moved their bowels, and a cup of urine spilled on the floor, and they have old chicken wings and Chinese food and pizza all over the place. Whatever it is, I look at them for what they are. They're a person who's suffering. So the very first thing I need to do is make sure I don't get upset at the person and just get out of there as soon as possible. Remember, scene safety, BSI, this is not safe. You want to get out of there. So the first thing you want to do after respecting the person's modesty and trying to get them out of there in a safe and timely manner is expedite the transport. And the way you expedite the transport is use sheets. Use bed sheets to get the person out of there, the ambulance bed sheet. Because these bed sheets can be doubled as something that would help you transport the patient out of there. And also, if you have more than one bed sheet, you can use more and more bed sheets to cover the patient up. So if they happen to have feces on themselves, the more bed sheets you put on them, the less you'll be having to smell them. And then once you get them on the ambulance, or if you can right here, you take vitals, you put them on oxygen, you start an IV, you do all the stuff that you have to do. And after the call is done, then you go out of service for body substance isolation, because the cardiac monitor, your BP cuff, it has to be sanitized from touching a person that is living under these circumstances. So, in a nutshell, when you have a hoarder, cover up your nose, cover up your respiratory passages, put on gloves. If you have to, put on a gown. Make sure you put on eye goggles if you need to. Then get the person out of there as soon as possible. And the best way to do it without having to touch them or having to put them on your uniform, which is probably going to happen anyway, but you could decrease it by using the bed sheets, put them on oxygen, expedite transport, elevate their legs because they're most likely malnourished. Check their finger stick, they're most likely malnourished and may have a low blood sugar. Give them what they need, and by all means, get out of there because it stinks. All right, my people, respect the patient, be a patient advocate, and that's why I created the Advocacy Alliance. It's for committed responders who are patient advocates, So if you want to do right for your career, if you want to do right for your patients, every single patient, you want to do the right thing for them, then click the link below. I'm going to give you free access to the weekly newsletter, where it's going to help you. And I'm going to share with you over 20 years of experience. And at the end of the form, you'll have the opportunity to join me live on a weekly basis to answer your questions virtually live. All right, my people, peace.